Okay pa kamo guys?
Yes.
Arrive, awake, enthusiastic.
Ay, naku. Attract positive vibes. Alright. Okay. Where are we? Wait lang. Sino to? Okay. Noted ang attendance. Okay. So, next is, let's go to, di na to tuman. Amino. Okay, yeah. Okay, so, sabihin ko to nag-stop man.
Sa Phyocyanin, ma'am.
Phyocyanin, color blue. Okay. Damdaman ka na. Thank you. Okay, phyocyanin, blue-colored media because if we could test our Pseudomonas aeruginosa from the antibiotics, no, nga, for example, ga-perform kita sa Kirby-Bauer diffusion test or disc diffusion test. Originally, your Mueller-Hinton agar is color yellow. However, if we isolated the Pseudomonas aeruginosa nga microorganism, so that yellow na Mueller-Hinton agar will become greenish to or green to bluish nga nga color sang media. So only Pseudomonas aeruginosa has the capability to do that because may phyocyanin na siya. Okay, next is Pseudomonas cepacia. Most commonly noted ni siya sa cystic fibrosis, no? Cystic fibrosis. So it affects daw the mucin of the host wherein nga may accumulation of the mucus after that and then it will cause cystic fibrosis to the patients. And then colony is yellow to yellow-green colonies with serrated edges. Kung magkambal ka serrated edges, syempre, hindi na siya, hindi siya smooth ang edges niya, kundi dumay pointy edges. And then next, pseudomallei can cause glanders disease. So what is glanders disease? Ano si glanders disease, guys?
Disease in horse.
Okay, disease na siya sa mga horse, no? Disease sa horse. However, si pseudomallei naman, ano na siya? Ang glanders-like disease na siya or milioidosis. Ano naman ang affected na host?
Humans.
Ano?
Humans.
Okay, very good. Humans ang affected na host for glanders-like disease. For glanders disease na siya sang host which can be transmissible to humans. Okay, this glanders disease can be diagnosed by Stross test or STRA-US test. Okay, so male guinea pigs inoculated peritoneally with suspected material or test microorganism within 2 to 3 days. And then if the guinea pig will develop orchitis, okay, male guinea pigs lang dapat, okay. So if the male guinea pig will develop orchitis, amo na siya nga positive siya kay Pseudomonas mallei or Burkholderia mallei. Okay, so next is Pseudomonas pseudomallei will cause milioidosis gani or glanders-like disease. So most commonly or most prevalent ni siya in Southeast Asia, it means diri sa aton, no? Southeast Asia and Australia. And then your Burkholderia pseudomallei is also nicknamed as a Vietnamese time bomb or Whitmore's bacillus. Whitmore's bacillus, Whitmore, bacillus, and Vietnamese time bomb. Okay, next is your Echinella corrodens. Okay, Echinella corrodens is the agent of human bite and clenched fist wounds. Okay, so it has a bleach-like odor and has the capability to corrode the agar. Okay, sa ngalan niya pa lang, no, corrodens, no, corrodens. So, it corrodes the agar. Next is your Flavobacterium. Ari naman, Flavobacterium, specifically si Flavobacterium meningosepticum. Your Flavobacterium meningosepticum, um, uh, it is the most clinically significant niyang species which will cause neonatal meningitis. And then, this Flavobacterium, may pigment ni siya, yellow pigment on blood agar plate, and ginatawag natin nga pigment is flavin. Okay, sa ngalan niya man, Flavobacterium, flavin ang yellow pigment. And the next is your Wixella zoohelcum, can cause animal bite wounds and scratches. Wixella zoohelcum. Okay, so next is motility, pigment, glucose oxidation, and growth at 42 degrees Celsius. Okay, so motile C, Pseudomonas aeruginosa, Cepacia, and Zoohelcum. And then other than that, they are non-motile. Okay, so mostly noted, Pyocyanin, color ano ang pigment?
Blue.
Okay, color blue. Kung pyoverdine,
Blue.
pyoverdine.
Green.
Okay, that is color green, and pyorubin is
Red.
Red.
pyomelanin is
Brown to black.
Brown.
brown or black or ati color. Char ati color. Ka-racist sa akon. Joke lang na. Okay, pyocyanin blue, pyoverdine is green, pyorubin is red, and pyomelanin is brown or black. Okay, so glucose oxidation. Pseudomonas aeruginosa has the capability to oxidize your glucose ano na gani, using your OF test bala, no? OF test. And then, remember nyo, si Pseudomonas aeruginosa has the capability to grow at 42 degrees Celsius. Take note nyo ni siya that this is the only test that you can differentiate, you can differentiate Pseudomonas species from Pseudomonas aeruginosa from the other species nga Pseudomonas. Okay, because Pseudomonas aeruginosa is the only Pseudomonas nga makagrow sa 42 degrees Celsius. And this Pseudomonas pseudomallei bala, ginilog ko lang ni siya ang old name ni Pseudomonas pseudomallei because subong ginagamit natin is your Burkholderia pseudomallei. Pero kay P. pseudomallei siya sa PowerPoint niyo, so ginilog ko lang danay. Okay. So next is your Pseudomonas cepacia or Burkholderia cepacia, positive sa motility, negative in pigment and glucose oxidation, and has the variable growth at 42 degrees Celsius. Okay. So, amo lang na siya, you study this table, and then after sina, its clinical significance, the laboratory test, and sa sa non-fermentative gram-negative bacilli. Okay. So, do you have any questions in your non-fermentative gram-negative bacilli?
None.
Okay. So, sorry gida. I just want to share, rin ni siya sa book ninyo na 3 Billion Scots, 13th edition, page 342. Okay, so we have this several tests, no, nga ginahimo sa Pseudomonas or non-fermentative gram-negative bacilli. So if you have ano ni gani, e-book or ano ni hard copy sang book, ara siya sa page 342. Okay. So let's go to our last topic, the antimicrobial susceptibility testing. So considerations in choosing antimicrobial agents, gindiscuss ta ni siya kahapon, no? For sure, wala man may nalimtan gid dayon, di ba? Okay. So, considerations, syempre, you always consider the lethal effect of the drug first before giving it to the patient. Next, toxicity level to the host as well as to its normal flora. Will it destroy or will it um, uh, least nga maapektuhan ang normal flora? So, dapat least dosage lang in order to not destroy the normal flora of the host. Next is pharmacological properties and host underlying condition, kung ano ang mga na-take niya nga mga drugs before, and then maintenance, and then after sina is their age, and then drug allergies. So, dapat take note ni na danay before ka mo maghatag sang or magpili sang iya nga antibiotics. Because, ano gani ang ginahatag sa pasyente nga may allergy sa penicillin? Erythromycin. And then next is organ function. Because organ function, we need to assess danay first the organ function of the donor. That is the donor, the patient. Okay, organ function danay. We need to have laboratory tests before we prescribe before the doctor before the doctor prescribe a medicine. That is why being a medical technologist is really important because before maghatag sang bulong ang isa ka doktor, garilay sa danay sang result sa laboratory sang pasyente. Okay, hindi basta-basta makahatag sang bulong kung wala nakapalab test ang pasyente. Okay, pero kung mga common lang mga antibacterial infection, so dasig lang man na siya. Like for example, mga ubo-ubo, di ba? So ginatagan ka muna mga amoxiclav, mga na siya. Kadamo lang. Okay, so organ function, the main organ that we need to assess is the liver. Okay, because of hepatic function ni liver nga i-biotransform ang drugs, and then kidneys for drug elimination. And then next is route of administration. As what I have told you, it can be administered topically. Ang apply nyo lang sa inyong skin. Pwede man na intravenous, pwede ang intravenous common niya siya nga ginahatag kung admitted ka sa hospital. For faster effect of the antibiotics, amo na siya kung nga ginahatag siya intravenously. And then may man kita intramuscular, subcutaneous, and subcutaneous. And most common is the oral. Okay, tandaan nyo, the most or fastest or most effective route of administration is intravenous. Okay. So next is cost effectiveness. Okay, hindi man pwede na mahal ang antibiotics pero gamay ang iya nga bisa. So dapat cost effective siya, no? Common siya sa mga antibiotics nga mga ginakombo bala, or like for example sa TB drugs. Kay diri sa Philippines free ang TB drugs mo or anti-tuberculosis nga drugs. So supposed to be mahal-mahal na siya because there are 5 antibiotics that is being included in one drug. Amo na ka potent ang anti-TB drugs na subong. So 5 ka antibiotics ang incorporated sa isa ka drug. Okay. So amo nang ginatawag nga naglima na siya because simple antibiotics or one antibiotic drug cannot defend the body against the microorganism already because the microorganism develop antimicrobial resistance. And that is one of the most common things na nga kakalatabo subong. That is the effect of self-medication. Amo na siyang harmful effect ni self-medication. Because in the long run, if you do that, you are self-medicating antibiotics. So, ang tendency sina is hindi na mag-effect sa imo ang mga simple lang mga antibiotics kundi tagduwa-duwa na ang ginahatag sa imo. So, good thing nga without prescription of the doctor, there will be no antibiotics to dispense in the pharmacy or from the pharmacy. Okay, so general considerations, we need to use the pure culture or pwede man standard size inoculum, and then selection of antimicrobial agent or antimicrobial panel. Okay, so antimicrobial susceptibility test can give us quantitative or specific numbers of results or dosage of antibiotics. And the next is qualitative. We use this Kirby-Bauer test. Okay, so this is our macro broth dilution susceptibility testing. So each tube has different concentration of our antibiotics, same concentration of our inoculum and NSS. Okay, gavary lang sa concentration ni antibiotics. So i-incubate natin siya and we could determine the MIC or minimum inhibitory concentration. And then after that, we need to subculture that to the agar plate. Okay, and then strict it. So after some third day, we are able to get the MBC or minimum bactericidal concentration effect ni antimicrobial agent or antibiotics. Tandaan nyo ha, if it shows turbidity or bubbles or any change in color sa tube naton, there is possibility na may growth sang aton test microorganism. So dapat before you determine the MIC, dapat ilantawon nyo gid clearly kung diin last nag-clear ang aton na tubes, because kung last nga nag-clear, it means there is no growth already, or that is the tube of our MIC. Okay. So next is microbroth dilution susceptibility testing. This is, if you could still remember kahapon, we are using this microtiter trace or microtiter wells and has the final volume of 0.1 ml. Next is your gradient diffusion test, also known as epsilometer test. So this epsilometer test, amo ni siya ang iyang tsura, and then each disc here or each paper signifies one type of antibiotics. Like for example, mga methicillin, colistin, nystatin, nitrofurantoin, chloramphenicol, or whatsoever. So each strip signifies antibiotics. So IP, amo ni siyang another example ni antibiotics, si IP. Ano meaning ni IP man? Nalipat po. Anyone who knows the meaning of IP as antibiotics? Wala. Ano na siya man? Nalipat ako. IP. Okay. So, numbers here in the strip are signifying the concentration of our antibiotics. So, kung di nag-meet ang colonies naton, amo na siya ang concentration ni antibiotics. Okay, so next is, or the last method is, we have this Kirby-Bauer technique or disc agar diffusion test. It is the most flexible and cost-effective method. Zone of inhibition is inversely related to MIC. Okay, so we need to pick 4 to 5 pure isolated colonies, and then tunawon na siya naton sa tryptic soy broth or NSS. Store at 35 degrees Celsius only for 2 hours. For that nga mag-enhance ang iyang growth sa microorganism. And then after sina, we compare the turbidity with 0.5 McFarland standard. Ang component ni McFarland standard, always remember, hindi pag limtan. Halin sa volume hasta sa percentage sang sulfuric acid kag barium chloride. And then next, ari hindi man ipagtandaan, hindi man ipagtandaan, hindi paglimtan, that equivalent of our 0.5 McFarland standard is 1.5 times 10 raised to 8 CFU per ml. Okay, so next, you strict the swab or test organism to plated media 3 times with 60 degrees nga rotation. Depth of our Mueller-Hinton agar must be ranging 3.3 to 5 mm deep lang or 4 millimeters deep with a pH of 7.2 to 7.4. And then color red na MHA is being mixed with sheep blood agar. And sheep blood agar is supplemented to support the growth of Streptococcus pneumoniae species. So this Streptococcus pneumoniae species will cause pneumonia or meningitis also. Next is HTM. HTM is 2 or 4H influenzae. So supplemented with hematine, NAD, and yeast extract because hematine is for X factor and NAD and yeast is for V factor. Okay, so next, commonly sa hospital, wala kami ni nagagamit sang antibiotic dispenser. Bali ginamano-mano siya namon buntis, balang ginakwa, gina-forceps namon halin sa area sa dispenser, mauti pa naman ni kung hindi mo gid nakasanayan bala. Okay, so ginakwa mo ni siya ang ari sa pinakababaw-babaw and then gina-plate mo siya sa imo nga agar surface. Okay, so always remember these measurements. Kung 90 mm ang plate, 8 disc ang kinanlan mo. Pero kung 150 mm, 12 to 14, pwede. This edge from the disc or distance from the edge is 15 mm, but distance from any disc is 24 mm. Okay. So invert plates to avoid the accumulation of moisture. Always ginabaliskad niyo na siya. Because ang tendency kung wala niyo siya ginbaliskad, ang moisture nga ara sa takop, mahulog siya sa ato na plate. And the next, the SIR and considerations in Kirby-Bauer testing. When you choose pure inoculum, always remember nga isa lang na siya or ginatawag natin nga same morphotype. Okay, inoculum streaking and placement of antibiotic. This 60 degrees ang rotation in streaking, and then within 15 minutes of this placement, plates are inverted and incubated. Because what will happen gani if there is delay in incubation? Ano gani? False
sensitive.
Okay, delay in incubation will cause false sensitive. And then next, reading of plates and interpretation of results. Plates are examined 2 to 3 above the block non-reflective surface and zones and are measured from the backside of the plate. However, actually wala man gini super naman gina-practice ang mga non-reflective surface kay because the countertop of the hospitals are mostly tiled. So ang tiled, di ba, reflective na siya? Kay duga mirror lang man sa kung kinis-kinis, no? So reflective. So ang ginahimo namon is hindi man siya shadow kabudlay mag-measure actually sang zone of inhibition. It's just that non-reflective surface will enhance the visibility of zone of inhibition. Okay, so if the growth is poor and non-confluent, test should be repeated. Okay, so kindly read this cause of false resistance for the antimicrobial susceptibility testing. Okay. So, i-read nyo man niya siya, may idugang lang ko tani sa false resistance. Concentration of calcium and magnesium in the susceptibility media. Okay, if there is calcium and magnesium sa media natin, like for example, your Mueller-Hinton, so it will cause resistance ni Pseudomonas aeruginosa against kay aminoglycoside nga antibiotics nga aman because your calcium and magnesium are cations. So, pariyo man na siya sa property ni aminoglycosides nga cations or positively charged. And then, your Pseudomonas aeruginosa, no, since Pseudomonas aeruginosa is an acidic nga component or has the acidic component sa iyalawa, so negatively charged na siya. So imagine your Pseudomonas aeruginosa, sorry. Ay, ala. Okay. So, Pseudomonas 10. So, Pseudomonas aeruginosa is, like for example, amo ni si Pseudomonas. Okay, so bacilli. And then negatively charged na iya nga palibot. Okay, negatively charged. And then kung ang imo nga medium is positively charged, okay, so amo ni si calcium mo be like for example, 2 ka plus, si magnesium mo amo man ni 2 man ka plus. Naintindihan niyo akong drawing, guys? Do artistic man.
Yes, ma'am.
Okay. So, next is madrawing kita nga kay aminoglycoside. Si aminoglycoside is, like, for example, ano siya? Gamam na. Sure. Okay. Aminoglycoside is positively charged man siya, no? Okay. So, positively charged nga 2 plus man. Okay. So, anong matabo? Gani, kung may calcium and magnesium, may false resistance. Okay. Nga aman, because these binding sites aring negative sa palibot ni Pseudomonas aeruginosa will be occupied by your positive ni calcium. So, amo ni i-occupy na siya ni calcium. Occupy pagid siya ni magnesium. So, ang mabili na lang kay aminoglycoside is gamay na lang. Pero hindi man gid hindi man gid na ang super nga illustration. Pero amo lang na, may naga-compete. Ang thought is, may naga-compete sa binding site ni aminoglycoside kag ni Pseudomonas aeruginosa, which are calcium and magnesium. So, if that would be the case, the aminoglycoside cannot act against the Pseudomonas aeruginosa. So it means wala sang matabo nga pareho sini zone of inhibition. Kay man false resistance. So amo ni siya ang effect. Ari ang may check, wala siya sa zone of inhibition. So nagets niyo na, guys?
Yes, ma'am.
Okay. So may question pa? Tandaan nyo lang, false positive, false resistance, false sensitive, or false susceptibility. Ano pag ito? Kay ari naman tanan actually sa notes ninyo. Okay. So, ano pa? Kung may question ka, mamba lang. Oh. Ay, may idugang ko gali, sorry, gid. Di na to gani man. Okay, QC sang aton Kirby Bauer this diffusion test. Ari, 10 minutes na lang . Okay, so Kirby Bauer this diffusion test, tandaan nyo, ang ginagamit naton for antimicrobial susceptibility testing na QC for gram-negative drugs are E. coli. Okay, si E. coli for gram-negative. And then next is Staphylococcus aureus naman for gram-positive. Ga-take down notes ka mo or sorry, gid.
Yes, ma'am.
Yes,
And then
ma'am.
next, Pseudomonas aeruginosa for aminoglycoside and other gram-negative drugs. Pseudomonas aeruginosa for aminoglycosides and other gram-negative drugs. Okay. So may question pa? Wala naman. Ano? Hindi, ako hindi, sorry.
Ang Ificalis.
Liwat-liwat sa...
Enterococcus faecalis, ma'am. Ang Enterococcus faecalis, ma'am.
Okay. Si Enterococcus faecalis. Ang kagapon to, no? Sakto? Okay. Si Enterococcus faecalis is gram-positive man na siya. So, it can be used also for your gram-positive drugs. Okay na?
Yes, ma'am.
Okay. So, wala na... Ano? May question pa, guys? So, I will leave, kung wala naman sang question, I will leave this thought to you, no? Train your mind to see the good in every situation. Okay, so whatever it is that is happening, so feel thankful or be thankful kay though it's the least that we can do, however, it has the greatest impact. Okay. So, okay na ta?
Yes, ma'am.
Yes,
Okay.
ma'am.
And then next is, naka-check naman ko sa attendance nyo. And then thank you kay nangin part ako sang inyo summer journey. And first online class. Okay, so
Thank
yeah.
you,
Thank you,
ma'am.
Thank you,
Thank you,
ma'am.
ma'am.
Thanks, ma'am.
Arigato gozaimasu. Gapa feeling Japanese ko daan. Oni-chan. Diba? Okay, so ihatag ko ang floor. Or siguro ma-break pa man na si Sir Jessie 15 minutes kay ano oras man. Okay, 2:47. So sakto gitna siya nga mabalik ka mo ba nga 3:05. Sir Jessie, na siya, sensei.
Yes, Je.
Oo, ma-break ka danay, Jess, or madiretso-diretso ka?
Breakdown. 15 minutes lang, guys.
Actually, guys.
See you by 3:05. 3:05, guys.
3:05. Sige, Thank you, good Sir Jessie. Everyone, thank you, good sa
Thank you,
inyo.
Je.
Oo.
Thank you, ma'am.
Thank you, Ma'am RJ.
Bye, ma'am.
Bye,
Bye,
bye.
ma'am.
Like,
Thank you,
like,
ma'am.
subscribe, and share
Bye,
na.
ma'am.
Enjoy
Kumay.
kita mo
Bye, ma'am.
Ano?
mga jokes mo.
Mga joke. May joke ako gali. Okay. Kasi hindi ko angayan mag-joke daan. Okay. So, thank you everyone. God bless. Good sa inyo. Like, subscribe, and share. Ano?
Shout out.
Oo, shout out na kakaroon. Mag-live sa YouTube. Ipadamon ko na nga pang subscribers, guys. Thank you everyone. Goodbye and good night.
Bye, ma'am.
Bye-bye.
Bye, ma'am.
God bless sa inyo.
Hello, ma'am. Bye.
Yes, God bless sa inyo. Kagtuon ka mo mayo. Makapasar ka mo sa bakte,
Thank you, ma'am.
Hindi mo breakdown.